Good day. I am Dr. Reynaldo ROJoson. I was asked to give a lecture with this title, Importance of Hospital Quality Accreditation for HA 202 with a time limit of 45 minutes and with the following prescribed learning outcomes or objectives. 1. Understand the importance and value of adhering to quality control standards when it comes to managing the hospital and its different departments and services. 2. Discuss the philosophy, objectives, structure, staffing, policies, systems, and methods of hospital quality accreditation. 3. Develop the ability to pinpoint and isolate management and administrative problems in the hospital quality control program and offer relevant solutions. And 4. Draft a hospital quality management system framework patterned after ISO 9001-2015 framework that can be used as a guide for developing a hospital-wide governance and operations manual. Let's start with the first learning outcome or objective, which is the importance and value of adhering to quality control standards when it comes to managing the hospital and its different departments and services. A patient client tends to go to a particular hospital because of known quality services in this hospital. A physician client tends to send his or her patients to a particular hospital because of known quality services in this hospital. A hospital wants to attract patient clients and physician clients to its hospital through its quality services. These three primordial realities and practices constitute the first general driving force why a hospital and its departments and services should promote and offer quality services to its clients. Promoting and offering quality services to patient clients and physician clients should be part of the business development program of the hospital and its departments and services in attaining financial viability and sustainability. The hospital and all its departments and services should have a quality management system in place as part of its business development program. The quality management system includes defining first the quality expectations of the patient clients and physician clients, then finding ways on how to meet these expectations. After the quality management system has been developed, it should be institutionalized by continually doing quality control, meaning continually fulfilling the requirements of the clients and documenting it on a manual that contains the quality control standards which all staff should know, adhere to, and make decisions according to them. Aside from making the patient clients and physician clients experience and appreciate the quality services, the hospital can go for external accreditation, not only to have affirmation and validation of its quality management system, but to utilize external accreditation for marketing. Thus, the importance and value of adhering to quality control standards when it comes to managing the hospital and its different departments and services are to attract patient clients and physician clients to utilize the services of the hospital because of a reputation of quality services that results from adherence to quality control standards. Let's now go to the prescribed learning outcome objective number 2, the philosophy, objectives, structure, staffing, policies, systems, and methods of hospital quality accreditation. Philosophy of hospital quality accreditation. Here I will present theories and ideas, information on hospital quality accreditation as being practiced in the Philippines, and my personal thoughts, perceptions, opinions, and recommendations on hospital quality accreditations. First of all, what is the difference between hospital licensure and hospital accreditation? Hospital licensure means obtaining an official and legal document or permit to operate a hospital from the Department of Health. A permit is granted after the hospital fulfills certain minimum requirements imposed by the Department of Health. These requirements usually include those that ensure structural and operational safety, human resource, and among other things. Furthermore, they may include imposition of the presence of a quality management system. Hospital accreditation is operationally defined as the processes by which a hospital voluntarily applies for recognition or attestation of compliance to certain set of standards by a third party. The standards may be anything that the hospital wants to have an external recognition of compliance and wants to use it for business development purpose. The standards may be on hospital management system, quality management system, environmental management system, disaster response, recovery, and business continuity, etc. Thus, the main difference between hospital licensure and hospital accreditation is the required legal permit to operate for licensure, and for accreditation, voluntary seeking for recognition or attestation of compliance to certain standards to be used for business development. What is the difference between hospital accreditation and hospital quality accreditation? There may be a difference, or they may loosely mean the same thing. In the strictest sense, they are different. Hospital accreditation is the process by which a hospital voluntarily applies for recognition or attestation of compliance to certain set of standards by a third party. Here, there's no standard that is specified. Whereas in hospital quality accreditation, the standards sought for the accreditation is the quality management system standards. As I mentioned earlier, hospital accreditation and hospital quality accreditation may loosely mean the same thing. Although there are various sets or subsets of standards to be assessed and accredited with, such as the generic quality management system, quality healthcare and patient safety management system, human resource management system, environment management system, and emergency and disaster management system. All these subsets may loosely be called quality management system or different types or subsets of quality management systems. If this is the case, then the hospital accreditation and hospital quality accreditation may be the same. One just have to qualify the definitions of terms to be used. To further amplify on the use of two terms, let me introduce ISO and its working on certification of standards. ISO is the acronym for International Organization for Standardization. It is headquartered in Switzerland. It is the most popular and respected worldwide organization that works on the standardization of things. It defines rules and standards to aid in the task for virtually all products and services that people use, including rules and standards about how products and services are made and to be done, and how quality control tests should be performed. ISO has about 300 standards that organizations can seek certification from. Some examples of ISO standards which are identified by numbers: ISO 9001 Quality Management, ISO IEC 27000 Information Security Management System, down the line. In the Philippines, the most popular standard, ISO standard being sought for by the organizations, particularly the non-medical enterprises, is ISO 9001, which is on quality management. The second one is ISO 14000, which is on environmental management. An organization which has an ISO certification should specify the type. Example, Organization X has ISO 9001 certification, which means certification is on quality management. And Organization Y has ISO 14000 certification, which means the certification is on environmental management. It is incomplete when one says an organization is ISO certified. One has to complete the description by specifying the type of certification. The same thing with hospital accreditation. One should not just say hospital is accredited. One has to specify which standards or which organization which give out the certification or recognition. In the Philippines, the following accreditation and certifications has been sought by hospitals: ISO 9001, Quality Management; ISO 14000, Environmental Management; Joint Commission International; Accreditation Canada International; PhilHealth Benchbook; Philippine Quality Awards; and Investors in People standards. With the various accreditations and certification being sought for by hospital, when one talks of having achieved a accreditation or certification, one should specify the name or the number in ISO. Going back to our topic, what is hospital quality accreditation? I repeat, it is the hospital's voluntary application for recognition or attestation of compliance to a certain set of quality management system standards set up by an external organization to be used as part of the business development program of the hospital. For purposes of my lecture, I will be referring to these standards: ISO 9001, Philippine Quality Award, Joint Commission International, Accreditation Canada, and PhilHealth Benchbook. Let's backtrack a bit. What is quality management system? ISO defines it as a management system that pertains to quality. But what is quality? Quality is defined by ISO 9001 as the degree to which an object or entity, such as processes, products, and services, satisfies a certain specified set of attributes or requirements. This diagram shows the current framework of ISO 9001 2015 version of quality management system, with customer requirements as one of the main inputs and customer satisfaction as one of the main outputs. The throughput uses the plan, do, check, act cycle in the integrated elements of leadership, planning, support and operations, performance evaluations, and improvement. Formulated standards are seen in number 4, quality management system; number 5, leadership; number 6, planning; number 7, support; number 8, operations; number 9, performance evaluation; and number 10, improvement. The Philippine Quality Award, or PQA, has this total quality management or performance excellence framework. Initially, the PQA has focused on business enterprises, the so-called business criteria for performance excellence framework. Now it has expanded to hospital industry. There is now a PQA healthcare criteria for performance excellence framework. Formulated standards to fulfill are seen in number 1, leadership; number 2, strategic planning; number 3, customer focus; number 4, measurement, analysis, and knowledge management; number 5, workforce focus; number 6, operations focus; and number 7, results. Can you now see some similarities with the ISO 9001 quality management standards? Examples of quality healthcare and patient safety management standards that are currently sought by Philippine hospitals are the following: PhilHealth Benchbook, Joint Commission International, and Accreditation Canada International. Comparing the 3 hospital accreditations, all are inherently for hospital accreditation, unlike ISO and PQA, which started and are more inherent in the business and manufacturing industries. All 3 emphasize quality healthcare and patient safety, and all 3 have 2 major categories of standards, namely patient-centered standards and healthcare organization management standards. Accreditation fees. Hospital accreditation almost always entails fees. Fee for the survey or assessment and fee for the certificate. How much the fees are is dependent on the accrediting body. This table shows the various accreditation fees. Take a look. They range from 10,000 pesos for PhilHealth Bench Book to 14 million pesos for Joint Commission International or JCI. What are the currently sought accreditation by hospitals in the Philippines, advantages and recommendations? PhilHealth Bench Book is a local standard directly related to Philippine hospitals. It will be needed for licensure with the Department of Health. My personal recommendation, all Philippine hospitals must have for viability and sustainability reasons. PhilHealth Bench Book. Joint Commission International and Accreditation Canada International. These are international standards directly related to hospitals, recognized internationally and prestigious. My personal recommendation is to go for one if the hospital has a tourism project and needs leverage with international collaborators and partners. ISO 9001, this is an international standards on basic quality management system that is applicable to all kinds of industry, including hospitals and healthcare. My personal recommendation is to go for it if an international accreditation is deemed needed and one cannot afford the fees of ACI or JCI. Philippine Quality Awards, this is a local standard that covers all kinds of industry, and there is a specific set of standards in healthcare right now. My personal recommendation is to go for it if the hospital wants to have the highest, most prestigious quality awards in the Philippines, as this is being awarded by the President of the country of the Philippines. Objectives of hospital quality accreditation. The general and overarching objective is that the hospital quality accreditations are used for business development program of hospitals to enhance the reputation so as to attract more patient clients and physician clients to utilize their services, thereby promoting financial viability and sustainability. Hospital quality accreditations are also used in the following: to increase the hospital's credibility and to demonstrate its accountability to the community using an attained hospital accreditation, to increase its leverage with the potential partners and collaborators in the healthcare industry using the attained hospital accreditation, to use the accreditation project as an assessment tool on hospital performance as well as a change management tool, to identify and institute areas of improvement towards excellence with the help of the hospital accreditation project, to educate the staff on performance excellence with the help of the hospital accreditation project. Structure of the hospital quality accreditation. The hospital quality accreditation can be looked at as a program or project. It can be temporary or permanent basis. My recommendation is that it should be on a permanent basis once the hospital administration has decided to go for hospital quality accreditation. One, the accreditation is usually for a limited time period only, renewable, say every 3 years. Two, there is a need to continually train staff on quality management system and to continually monitor conformance to standards. The hospital administration can either create a committee or an office for the hospital quality accreditation project or program. Committee if the program would be short-term, office if the program will be long-term. Staffing of hospital quality accreditation. Strictly speaking, staffing of hospital quality accreditation program involves all staff of the hospital, from top management to rank and file, all working in an aligned and integrated fashion towards attainment of the external recognition. To orchestrate or direct the hospital quality accreditation program, a committee or an office may be created. Staff in this committee or office would be those knowledgeable on hospital accreditation processes and who can teach the rest of the hospital staff on quality management system, particularly on how to fulfill the requirements of the required standards, and who have leadership and managership skills. Since the Hospital Quality Accreditation Program is a hospital program and hospital-wide, all staff should be engaged, aligned, coordinating, collaborating, and integrating with each other to promote the success of the program. The steering committee, if present, or should be present, and should have a multi-sectoral membership. Cross-sectoral or multi-sectoral membership with representatives from key functional areas in the hospital, such as the following: medical service sector, nursing service, ancillary medical service, administrative or support service, human resource development sector, business development sector, finance sector, and a secretariat to help in the task. Policies of hospital quality accreditation. The primordial policy is that once the hospital quality accreditation project or program has been set up, all staff of the hospital, from top management to rank and file, should all be working in an aligned and integrated fashion towards attainment of the external recognition. The other basic policies should cover the following: what are the authorized functions and authority of the Hospital Quality Accreditation Committee or Office, and what are the punishment and rewards for non-conformities and excellent conformities, respectively, on established quality management standards. Systems of hospital quality accreditation. This involves system approach and system thinking. All departments and services should be involved in the hospital quality accreditation project or program. All departments and services should be aligned, coordinating and collaborating and integrating with each other in the hospital quality accreditation project or program to ensure attainment of the external recognition or accreditation. And it goes without saying that all the quality management systems of all the departments and services should be aligned and integrated also with each other to attain the highest degree of quality. Methods of hospital quality accreditation. Top management decides to have a hospital quality accreditation project using the following reasons: to promote the business development program of the hospital so as to make it viable and sustainable, to use it as a change agent to fast-track the quality improvement. Top management creates a steering team, committee, or office for hospital quality accreditation project with clear functions and authority. The membership of the steering team and committee can consist of the following: senior management representative, if not the hospital director, the chair with competency in hospital accreditation and leadership, and cross-sectoral and multi-sectoral membership with representatives from the key functional areas in the hospitals, as I have mentioned earlier. The steering team formulates a master plan for the hospital quality accreditation project, decides on a set of standards to be assessed or evaluated by an accrediting body, and then seeks commitment for support and collaboration from top, senior, middle, and lower management on hospital quality accreditation project. Before I go to the next prescribed learning outcome, let me discuss this topic first: the road to hospital quality accreditation. How necessary and who cares? Is it really needed? This is a common question asked particularly by hospital administrators and managers. Is hospital quality accreditation really needed? The general answer is it depends on your need and situation. If there's a need, If there is a need to participate in the National Health Insurance Program like PhilHealth and get benefits, go for PhilHealth accreditation. If there's a need to participate in medical tourism program and get the benefits, go for an international accreditation like ISO, JCI, or ACI. If there's a need to satisfy the requirements of corporate accounts, go for the accreditation. If there's a need to satisfy the expectations of the community, go for an accreditation. If there's a need to be known as the best hospital with performance excellence, go for PQA. Situation. If there is a situation such as to be with the trend of having an international accreditation, not to be left out because of strong community expectation, go for the accreditation. If there's a situation such as wanting to fast-track improvement of quality and safety of operations and services with accreditation, go for accreditation, where there will be assessment, training, improvement, and evaluation. If there's no need and no situation, then just be compliant with the standards and criteria without going for formal accreditation. Just accomplish compliance with self-directed learning and improvement. One can study all the stipulated standards in the different sets of published quality standards which are readily available in the internet and come out with an integrated checklist and then comply through self-directed learning, training, and continuous improvement. We have covered all the items in the second prescribed learning outcomes. Let's now proceed to number 3 prescribed learning outcome, which is to develop the ability to pinpoint and isolate management and administrative problems in hospital quality control program and offer relevant solutions. Here, I will share with you the common problems which I have encountered and the suggested strategic solutions. I shall categorize the common problems into 3 phases: pre-hospital quality accreditation phase, hospital quality accreditation phase, and post-hospital quality accreditation phase. There are problems that cut across the 3 phases, meaning problems that are present in the 3 phases, or problems in the earlier phase that may persist or spill over into the next phase or phases, and problems predominantly present in a particular phase. Here is a list of what I think are the common problems in hospital quality control program. 1, varying perceptions and definitions of quality of clients and hospital and department staff. 2, established mindsets and habits of staff from top management to managers to rank and file, where call for a change for improvement is difficult. 3, cost of accreditation, as accreditation entails cost. And 4, inherent difficulty in developing and institutionalizing a comprehensive, aligned, and integrated quality management system in a hospital. The foremost problem or challenge is the varying perception and definition of quality of clients and hospital and department staff. Patient clients usually have their own perceptions and definitions of quality. Physician clients have their own also, and the staff as well, staff of the hospital, whether medical and non-medical. To show you that this is the case, in 2010, I made a survey on the perceptions of hospital administrators, physicians, non-physician healthcare professionals, and patients on the parameters of excellence for quality in a hospital. A total of 141 respondents were obtained, or was obtained by May 31, 2010. 34 hospital administrators, 34 physicians, 34 non-medical hospital staff, and 34 patients. I got varied responses from one group of respondents to another. Collated responses revealed 58 specific parameters for excellence. That is very many, very varied, which can be grouped into 11 categories. The greatest majority of the respondents place infrastructure and facilities as the number 1 excellent parameter. Next, the medical equipment and drugs. Then governance with excellent service as number 4. On the specific parameters on infrastructure and facilities, there were varied perceptions of quality among the different groups of respondents. Just to cite 2 examples, a great majority of the non-medical staff put significant weight on modern structure and facilities compared to the medical staff. The hospital administrators, physicians, and non-medical staff put significant weight on complete and well-maintained infrastructure and facilities compared to the patients. On specific parameters on services, again, there were varied perceptions of quality among the different groups of respondents. Again, just to cite 2 examples, the physician and non-medical staff put significant weights on complete and efficient service compared to the patients. The physicians put significant weight on the presence of multi-specialty medical services compared to the non-medical staff and patients. So how do you resolve the varying perceptions and definitions of quality of clients and hospital and department staff? A suggested strategic solution: hospitals should look at the perceptions and definitions of quality of the clients, patients, as well as physicians, and try to meet the requirements as indicated and as appropriate. In ISO quality management system, the starting points are always the determination of customer requirements and needs and expectations of relevant interested parties. See the encircled boxes on the left side of the diagram. In PQA, the customer focus requires the organization or hospital to determine the requirements, expectations, and preferences of the customers. The standards have these items: voice of the customers, listening to the customers, listening to current as well as potential customers. In reality or real practice, it is extremely difficult to get uniformity on the needs of patient clients as well as physician clients, as they always have varying perceptions, definitions, and mindsets. Thus, to support this search for customers or clients' needs, a suggested strategic solution is to look at the current standards of quality in hospital, abroad, and at home, and adjust accordingly, and use this to manage the expectations of the patient clients and physician clients through education and changing their mindsets. The second most common problem or challenge is established mindsets and habits of staff, from top management to managers to rank and file, where call for change for improvement is difficult. Common contributing mindsets are: if it ain't broke, don't fix it anymore, and don't disturb our current comfort zone. The situation is particularly true where the hospital is currently financially stable, regardless of the status of its quality management system, and the owners and leaders are not wary of the threats to financial sustainability from other competing hospitals. These hospitals tend to preserve the status quo without continually improving their quality management system, and more so without going for hospital quality accreditation, particularly when the cost of accreditation is considered or factored in. For this problem or challenge on established mindsets and habits of complacency, and without putting utmost importance to hospital quality program, improvement or change in governance and leadership direction is crucial. The leaders and owners should first realize the importance of an excellent hospital control program in promoting financial sustainability. After realizing this and subscribing to it, they should take the lead, convince, and educate all their staff to pursue an excellent quality management system with or without hospital accreditation. Cost of hospital quality accreditation is a common and realistic challenge. As I said, accreditation entails costs. Here is a look again at the costs. The range is 10,000 to 14 million pesos based on this table. Remember, this table just shows the cost of initial accreditation. Maintaining the accreditation, usually every three years, also entails another cost. My suggested strategic solution is to look objectively for the indications for a hospital quality accreditation. One may not need a hospital quality accreditation if one can do self-directed learning, training, and improvement. Remember this slide that I presented earlier? If there's no need and no situation indications. Again, remember this slide on there's a need indication. Lastly, remember this slide if there is a situation indication. The fourth challenging problem, the most challenging, in fact, is in the hospital quality control program. So after a decision is made to establish and develop and institutionalize a quality management system, the most challenging is the quality management system itself. It is not easy. It is inherently difficult. It is extremely difficult, especially if one is to develop and institutionalize a total quality management system involving the whole hospital, involving the whole staff with varying healthcare professionals and healthcare support staff, where alignment and integration are key results areas and performance indicators. The challenge starts with the formulation of the blueprint, alignment and integration, implementation, monitoring for conformities and non-conformities, and formal evaluation of the QMS at planned intervals with continual improvement program. Challenges in the implementation: all staff from top management to middle managers and rank and file should be engaged, that means committed and trained, in the formulation of blueprints, implementation, and evaluation and continual improvement of the QMS. All staff from the top management to middle managers and rank and file should be constantly be aligned, coordinating, collaborating, and integrating with each other in accomplishing a total QMS. The usual findings in hospital based on my experience: you have a ningas kugon, incomplete and incomprehensive, not aligned, not integrated quality management system, hiding non-conformities to stipulated policies and procedures by staff, and in those for surveillance visit after initial accreditation, staff will work double time just to ensure passing by covering up non-conformities and catching up on fulfilling requirements of the standards rather than doing it on a daily routinary basis. This is a very tall order. It needs a strong leadership and extensive training. Before we end this section, here again is a list of common problems that I have observed in hospital quality accreditation. Varying perception and definitions of quality of the clients, as well as the hospital and department staff, established mindsets and habits of the staff, where calls for change for improvement is difficult, cost of accreditation, and the inherent difficulty in developing and institutionalizing a comprehensive, aligned, and integrated quality management system in a hospital. We now go to the prescribed learning outcome number 4, draft a hospital quality management system framework patterned after ISO 9001-2015 framework that can be used as a guide for developing a hospital-wide operations manual. This is the ISO 9001-2015 Quality Management System Framework, which can be used as a guide or the starting point to draft the quality management system of the hospital. One has just to put in description, elements, and preferably a management system in each of the boxes. One can read the stipulated standards of the PhilHealth Benchbook, JCI or ACI, and PQA, and incorporate or integrate them in the ISO standards or boxes as applicable. This is an example of an adapted framework from ISO 9001-2015. It can be used as a hospital governance and operations manual, as well as quality management system. The quality and safety management system is used instead of just quality management system to meet the requirements of the PhilHealth Benchbook and JCI and ACI or ACI. As mentioned earlier, one has just to put in descriptions, elements, and preferably a management system in each of the boxes, guided by and compliant with established standards in ISO, PhilHealth, JCI or ACI, and PQA. Once done, the whole manual shall be the hospital manual for quality and safety management system. At the same time, it can serve as the hospital manual of governance and operations. Preferably, there must be write-ups on each box or standards in the format of a management system as shown. And here's an example template in writing the management system of each standard with the following contents: title, concept, meanings, definitions, and scope, rationale, purpose, policies, procedures, work instructions, review, and non-adherence to established policies, procedures, and work instructions, with notations on document number, version, date of release, prepared by, and approved by. To end my presentation, I will flash again the prescribed learning outcomes or objectives which I have covered. Understand the importance and value of adhering to quality control standards when it comes to managing the hospital and its different departments and services. Discuss the philosophy, objectives, structured, staffing, policies, systems, and methods of hospital quality accreditation. Develop the ability to pinpoint and isolate management and administrative problems in the hospital quality control program and offer relevant solutions. And lastly, draft a hospital quality management system framework pattern after ISO 9001-2015 framework that can be used as a guide for developing a hospital-wide governance and operations manual. This is my last slide. I really hope that you have acquired the prescribed learning outcomes through my presentation. Thank you for your kind attention.